All right. Hi, everyone. How's everyone doing? I'm Eric VanderHelm, and I'm with HEADCHECK Health, and this is HEADCHECK Health Talks. And today, as our first ever episode, we have Dr. James Stavitz here to talk about athletic training and concussions in high schools. And just by way of introduction, maybe Dr. Stavitz, just introduce yourself and tell us a little bit about what you've been working on lately and what's going on in general in the space.
Yeah, so I'm Dr. James Stavitz. Thank you for having me. Basically, what I want to discuss here is my concussion management research focusing on a multifaceted approach and what the lived experiences are with athletic trainers, and maybe where's the disconnect when it comes to treating this young population, what we can do to better serve this community, and how we can communicate better with not just the athletes, but the coaches, parents, and athletic directors as well.
Okay, awesome. So you're an athletic trainer yourself, James. So what motivated you to want to dive into the research of how athletic trainers manage concussions using this multifaceted approach that you mentioned, and what particularly made you interested in looking at it at the high school level?
So that's a great question. So what motivated me was there was really this noticeable gap between what we teach and what's actually happening on the ground in high school settings, right? As someone involved in both clinical practice and education, I really saw firsthand that while multifaceted concussion management tools like the SCAT5 and neurocognitive testing and balance assessments, these are all widely promoted as the gold standard, but we really didn't have a clear picture of how consistently or really even effectively it was being used in high school environments, right? High school athletic trainers often work alone. They have limited resources. Sometimes they have limited support, but they're expected to make critical decisions in some of the most high pressure situations. So what I wanted to do was I wanted to better understand their real world experience, right? What tools are they actually using? What barriers might they face? How institutional support or lack thereof really influences their ability to manage concussions safely and thoroughly. So by focusing on the high school level, I was really hoping to almost shed a light on a part of the system that's often overlooked, despite it being where many of these athletes experience their first concussions.
Right. So at the high school level, I guess the concussion protocol, depending on how you look at it, could be quite complex and could be quite simple. But typically, what we see is that the concussion protocol is just like a PDF on a website somewhere, and
Mm-hmm.
that's kind of what makes it difficult to follow. Is it's not something that's easily accessible, especially with the resources that an athletic trainer might have. So I guess based on your findings, how would you describe the current state of concussion management in high school athletics, the way that they're able to actually follow that protocol?
So as we're seeing today, right, the current state of concussion management in high school athletics in particular is pretty inconsistent. Most athletic trainers are doing their best to follow evidence-based practices, right? The protocols that they use, how strictly those protocols are being followed, these all vary widely from school to school, from athletic trainer to athletic trainer to athletic department to athletic department, right? Some athletic trainers have access to these highly qualified, trusted physicians. They have a lot of administrative support. They have clear procedures, while others are kind of left to navigate these vague guidelines with pressure from coaches and pressure from parents with, not much or little institutional backing. There's also a lot of misunderstanding around state laws versus what's being recommended, right? Some athletic trainers believe certain steps are legally required when they aren't, and vice versa, right? So this lack of standardization really leads to unequal care where two student athletes with the same injury might receive very different treatment based purely on where they go to school and what resources they have available to them, right? And this variability is a real concern for both the athlete's safety and the athletic trainer protection.
So on the one hand, you need a need for standardization. You need to have you said that lack of standardization can pose a risk to the student athlete, to the school. But on the other hand, we need to have some room there for these medical professionals to make decisions. So how do you reconcile that in the high school setting?
It's tough. It's tough. When it all comes down to it, it comes down to really setting a standardization, a standardized approach, having a clear protocol, and just working with all of your support system that you have, making sure that the athletes and the parents and the coaches and the athletic department all are kind of aligned on this protocol and really have a good understanding of what these protocols are, and not only what the protocols are, but the reasoning behind this, right? A lot of times when we see an athlete and they get injured, a lot of the questions that we get, or even pushback that we get from any of these systems, whether it's the parents, the coaches, sometimes the athletes themselves, is why, right? Why are we doing X, Y, and Z? So painting a clear picture and really educating and understanding all of these variables is going to make a very clear and consistent protocol, so the athletic trainer really doesn't have a lot of pushback when it comes to trying to implement all these procedures.
Right. So athletic directors, school administrators, they can help support these athletic trainers then by supporting them in their adoption of these evidence-based protocols. But you also cite in your study some pressure from coaches, parents, or even the athletes themselves. How does that play in here with these external forces impacting the athletic trainer's ability to manage those concussions, getting pushback from the athletes or the parents themselves?
Right. That's a great question. So external pressure significantly implicates an athletic trainer's ability to manage these concussions. It makes it very complicated. Many participants in the study that we did really described feeling pushed, sometimes subtly, sometimes directly, by coaches who want their players back, by parents who minimize the symptoms, or athletes who are eager to kind of play through it, right? So this pressure can really begin to undermine clinical judgment from the healthcare providers. And that can start to lead to protocol shortcuts, right? That can start to cause second guessing, where athletic trainers are trying to act in the athlete's best interest. It's especially tough in a high school setting, right, where the athletic trainers are often working solo, as we mentioned, right? Sometimes they don't have strong institutional support or backup. Now, when the culture around them prioritizes competition over health and safety and recovery, it makes it really hard to enforce, that stepwise return to play protocol, or insist on physician referrals, right? In some cases, that pressure even led to the athlete being cleared by an unqualified provider chosen by a parent looking for a quick clearance. We see it all the time. Ultimately, this can pressure and cause pressure that is unnecessary, and can increase the risk of mismanagement and further concussions, and place the athletic trainer in an ethically and professionally vulnerable position.
It's a tough one to hear, because we've been hearing for a long time now, more than a decade. I mean, I've been in this space for 6-7 years at this point, and I always hear everybody say that education is the most important thing. We just need to educate everybody. If everybody's educated on the signs and symptoms of concussion, if we increase that awareness and education of the concussion, then the problem's going to be solved. It sounds like what you're saying is that that's just not enough.
Yeah, it's definitely not enough. It really all comes down to having everybody on board, and really having a clear understanding of what these protocols are. And as we mentioned before, as an educator myself, as well as working clinically, students and athletes are a lot alike, right? The way that you deal with students in the classroom versus the way that an athletic trainer deals with their athletes in the treatment room, right? So you can do all these different protocols, and you can educate all these different ways that you're going to try to treat all these symptoms and try to get these individuals back to where they need to be, if not better. But if they don't understand why they're doing what they're doing and what that process is, it makes it much more difficult.
Right. So not just education about the prevalence of concussions or the signs and symptoms of a concussion, but education on the protocol itself and why that protocol is important.
Exactly. Yep.
Okay. So referral processes, you cited they came up as a challenge in your study. So what can schools do to build better partnerships with qualified physicians or neurologists who understand concussion management?
It really comes down to taking a proactive approach by beginning to establish a formal referral relationship with local physicians or neurologists or anyone who specializes in concussion management, right? That might include creating a vetted list of providers. We've seen this before, creating a vetted list of providers who are trained in current concussion protocols and willing to collaborate closely with athletic trainers. And so some schools have had success through informal partnerships, right, where you build that trust with specific concussion clinics or these sports medicine practices that provide that timely informed evaluation. And others have partnered with local hospitals or local universities that have affiliated providers to really streamline the access to specialists. Administrators should also, right, when we're talking about athletic directors and administrators, they should also make sure that their policies support athletic trainers' discretion in referring to those providers. Right? Too often, referrals get overridden by parents who, quite frankly, opt for convenience over expertise, right? And that can lead to students being cleared by a general practitioner, or in some cases, a provider completely unrelated, who may not fully understand the whole concussion management process, right? So by establishing that clear referral pathway and educating families on why qualified care matters, right? Schools can reduce those delays and improve consistency and really begin to protect athletes from premature return to play protocols or decisions by establishing that clear referral pathway.
So on the note of the clear referral pathway, it sounds like it's really important to make sure that there is just a pathway just in general to be able to get a referral to a specialist, to be able to get treatment and clearance for a concussion. But would you say it's also important to make sure that that pathway includes, you mentioned convenience as well, it includes a way for that referred, the doctor that they get referred to, all the information about what happened at the time of the incident and any notes leading up to that point?
Yeah, 100%, right? That makes it so important. That makes it so important. So all of these stakeholders really should begin to invest in these policies and really start to support this process, right? And let the athletic trainer have the discretion in this process. We see it all the time, right? If referrals always get overridden by all these shareholders and stakeholders because they want to go for convenience over expertise, right? And that could lead to these student athletes being cleared by individuals who may not fully understand the full concussion management protocol, right?
Or that individual case.
Yes, or that specific case, exactly, right? Or that specific case, because as we mentioned before, you could have two athletes with the same injury at the same time with the same impact and get two completely different management processes, which, as you can imagine, right, can lead to that premature return to play decision for one, while the other one sits out because they do have that trust in that protocol. Now, is this with every single school? No, of course not, but we see it all the time.
Right. So for schools or school districts that have limited resources, what are some practical first steps they can take towards adopting a more comprehensive concussion management system?
Yep. So and this is very common, right? Schools with limited resources or limited budget, right? The most practical first step is education, right? Ensuring that coaches and parents and athletes, making sure they understand the seriousness of concussions and this head trauma and the importance of following this protocol, this stepwise protocol, the importance of understanding that athletic trainers are following evidence-based return to play process. And that can go a really long way in shifting this whole culture that we see. You can also have schools support their athletic trainer in using, it doesn't have to be so expensive, right? It can be a low cost, high impact tools like the SCAT-5, right? And standardized symptom checklists. And it includes balance assessments, which don't require expensive equipment, but still contribute to that whole multifaceted evaluation, which was what the research was all about. Establishing a written concussion policy that outlines clear procedures for assessment, clear referral process, clear return to play, right? This is all really critical in this stepwise approach. So even if access to specialists or neurocognitive testing is limited, which is not uncommon, right? Having a consistent documented process that starts to add structure and, if you think about it, accountability, right? And with all that being said, right, schools can begin building relationships, right, with local concussion specialists, even informally. It doesn't have to be this formal relationship. It can be an informal relationship. A single willing provider in your community can make a huge difference in beginning to streamline that care and providing that trusted referral process. So really, like, the key is starting with what's feasible in that sense, and then just building from there.
Right. So starting with the basic building blocks of, because I know when folks get a concussion, I know when I had a concussion, it's a stressful experience for the athlete and for the athletic trainer and everyone involved, the parents. They want to know that you have a plan, and you might not know exactly what, like, you might have a prognosis, but you might not know exactly what's going to happen on day 5 or 6 or 10 of the protocol.
Yeah.
At least if you know, like, hey, we have this protocol, at a bare minimum, we're going to do this, and then we're going to make a decision here. I think that can really make people feel a lot better. Do you think there's a psychological component, like a wellness component here, to making sure that protocols are implemented clearly and educating people?
100%. Having that clear protocol that's implemented and just trusting the process, right? Just establishing that written, consistent policy. We mentioned this before, right? Outlining the clear procedures for assessment, the clear procedures for referral and return to play. It's such a critical step. And right, so we get this a lot where sometimes you're in a rural area or an area that just doesn't have a specialist, or your neurocognitive testing isn't accessible as it is in some areas, right? That's okay as long as you have a consistent documented process that begins to add that structure and that accountability.
Okay, so you interviewed lots of ATs, and how is you keep talking about this multifaceted approach, so using tools like SCAT-5 or SCAT-6 now, neurocognitive testing, balance tested. So from the perspective of the ATs that you interviewed, how is using that multifaceted approach improved outcomes?
So from the perspective of the athletic trainers that I interviewed, the multifaceted approach has dramatically improved both quality of care and confidence in managing concussions, right? They described,
sorry, just to interject here a little bit. So just for the listeners, when you say a multifaceted approach, that is what's that opposed to, right? Is that opposed to using one test and just going based off the result of that test?
Yeah,
what's the opposite of doing?
Yeah, so the multifaceted approach is that stepwise approach that we mentioned. So not just going off of symptoms, right? A lot of athletic trainers,
not just symptoms.
Not just symptoms. It has to be a multifaceted approach. So not just symptoms, looking at balance assessments, neurocognitivity, as well as doing a symptom checklist and a very smooth procedure in their return to play protocol. So oftentimes in the past, right, and not that long ago, people were just going off of symptoms. They're, balance, you would talk about balance, but the main thing was, if you didn't have a headache or if you didn't throw up, then you were good to go, right? That's not the case anymore.
And so with the an improved outcome, can you define that? Is that a shorter return to play? Is that higher perceived wellness?
It's, everyone's biology is different.
Okay.
Everyone handles this trauma differently. It's hard to say, what's going to be better and what's going to be worse. But what we have found was that using this multifaceted approach, like the SCAT5 or the SCAT6, with neurocognitive testing, with balance assessments, that has shown to have improved outcomes, right, from the perspective of the athlete, from the perspective of the athletic trainers and the coaches and the parents and even the school boards and the administrators as well.
Okay, well, so we're coming up on the last couple of questions here, and these are just some more practical questions. So Dr. James Stavitz, if you're hired and you needed to change one, you were only allowed to change one policy or requirement in high school athletics, and based on the findings in your research, what would it be and why?
Such a good question. So if I could change one policy, I would require that all return to play clearances for concussed athletes come from physicians specifically trained in concussion management and not just any licensed healthcare provider. One of the most consistent and concerning findings in the research was that students were being cleared by physicians who lacked appropriate training, right? Ranging from general practitioners, in some cases, like completely unrelated specialists like podiatrists. We even had an athletic trainer. Yeah, we had an athletic trainer who one of their student athletes got cleared but by their OBGYN, just totally unrelated specialists. So this, and when you see this, right, and you hear this, it undermines the entire concussion management process. And that puts the athlete at risk, right? Because that's going to return them to play before they're really ready. So by mandating that only qualified concussion specialists can issue that return to play clearance, we'd improve consistency. We'd reduce premature returns. We'd protect the athlete, right? And we'd protect the school and the athletic trainer, right? Let's face the facts here.
What about the doctor too, though? Like the doctor that's kind of feeling forced by their patient to give a clearance note for something that
100%.
Is that a problem for them and a risk for them?
Absolutely. Absolutely. So everyone, all the stakeholders and shareholders involved in this, right? It really undermines that entire process. If you have these unrelated specialists, you're not going to have that increased consistency. You're going to have premature returns. And you're putting a real liability risk, right? Because let's face the facts here. You're putting a liability risk at the athlete, the school, the athletic director, and that physician or that provider that doesn't have that specialty skill set. You're putting all of them at risk. So, by mandating only qualified specialists can make those return to play clearances, is really going to help not only support the athlete and their family and the whole community, but that's going to support the athletic trainers. And that's going to really reinforce their efforts with medically sound collaborative care.
Yeah, makes sense. I mean, if I was an athletic trainer and I was about to put in all this work to make sure that I was following the protocol and adapting it as needed, and I knew that they were going to go and just get a clearance note from their dentist or something, I'd be very frustrated, I think.
And we see it all the time. And, we had one that got cleared by their podiatrist because the podiatrist was their neighbor.
Right.
right? So we see it all the time. So oftentimes, especially in high school athletes, a lot of these individuals are just getting cleared for convenience, and more often than not, it's not appropriate.
Okay, so last question here, and I guess bit of a preamble, but we talk to a lot of So I work for HeadCheck. I've been, like I said, around for 6 years or so, and I've talked to a lot of athletic directors, commissioners, sports executives in general, and a lot of times what I hear them say is, "Oh, that's interesting what your platform does, but that I'm sure my athletic trainer has it all handled. I trust them and I leave it with them." But what would you say to that athletic director, for example, who's seeing concussion management here as the athletic trainer's responsibility without their broader institutional involvement?
So what I would say is that, right, while athletic trainers are trained, right, we are qualified to lead this concussion management, we can't do it effectively in isolation, right? Concussion care requires institutional support because managing these injuries safely involves more than just on-field assessments, right? It includes timely referrals, enforced return to play and return to learn protocols, right? Communication with parents, and of course, right, accountability from coaches. So if an athletic director views concussion management as only the athletic trainer's job, they're missing the bigger picture, and they're putting both the athlete and the school at risk. The athletic trainer needs policies that are supported at the administrative level, right? They need systems that are in place for documentation and referral, and they also need school culture that prioritizes athlete health over convenience and over winning and playing time. When concussion management is treated as a shared responsibility, everyone benefits, right? The athletic trainers feel more empowered, their families feel better informed, and most importantly, right, the student athletes are safer.
Yeah, no, I think it's interesting to hear you speak, and I really appreciate you coming on, Dr. Stavitz. I think one of the takeaways I'm getting from this is that there's really a lot that we can do as the schools and school districts can do to improve things, and that's a heartening message to hear, because I know that there's big problems in the industry. It's part of the reason why HeadCheck exists, but it's interesting to hear from you and that people can be empowered to make these changes and support their athletic trainers in ways that don't necessarily require them to have a ton of resources to be able to put behind it. It's really a cultural thing, and it's just planning ahead and making sure that they have everything they need and that the culture and the team is all there to support them. Is there anything else that you'd like to add just before we wrap up today?
I just wanted to reiterate that when you treat concussion management as a community responsibility, everyone benefits, right? Everyone benefits. The athletic trainer benefits, the parents benefits, because it's so important that the families and the parents are not only informed, but they're a part of this process as well. And of course, making sure that the student athletes, because when it all comes down to it, right, we're doing all this to protect them and making sure that these individuals are safe and they know that they're safe and they're informed and they're empowered as well.
Awesome. Well, Dr. James Stavitz, I'm sure we'll link some of his recent work on here. Thank you so much for your time. It was great speaking with you, and thanks everyone who tuned in.
Thank you very much.